We've been talking about safe use of medication, and there's one medicine in particular that I want to talk to you about. It's prednisone, steroids. Steroids are incredibly common here. They are not prescription medications. That's any medicine with an S-O-N-E at the end of it. Even it just has to have an O-N-E at the end of it, like prednisone, methylprednisolone. Any of those medicines with steroids are really dangerous. Here's the problem with them. They're anti-inflammatory medicines, which means that they will quickly bring down whatever inflammation we have in our body, no matter what the reason is for the inflammation. So they seem like they're miracle meds. They really, really work well to make our sore throat go away, to make our cough better, to make our headache get better. But the problem is that they don't treat anything but the symptoms. And so they're not making the illness go away, they're just hiding the illness. And the big problem with steroids is that they have a lot of terrible side effects. They are so dangerous, in fact, that in many parts of the world you can't get them without a prescription. And in many parts of the world you can only get steroids if they're prescribed by a specialist doctor, not even a regular doctor. And I can tell you a lot about how I feel about medications and processed foods being sent over to lower income areas where people don't have good educations, and that's because the drug factories have to get rid of their meds. So they send them to innocent people who have no idea how bad they are in hopes that they'll buy them off the street. Here are some of the problems with prednisone and the reason that I don't want you to take it. If you take prednisone on a regular basis, it's going to make your blood pressure slowly go up. And you won't know why, because you're going to be feeling better, but it's because of the prednisone. Prednisone also causes acne. So people who have acne on their face or on their back in particular, it could be because they're taking chronic prednisone. For you gentlemen out there, prednisone actually causes your testicles to decrease in size. And that is not a medical myth, it's truth, I've seen it myself. It causes fat to develop on the back right here, a humpback fat. It increases bone loss, and it makes your blood pressure go up. As I told you before, it also makes your blood sugar go up, and that's diabetes. We already know that high blood pressure and high blood sugar are two of the worst infections, worst illnesses that we see everywhere in the world, and prednisone and poor use of steroids is part of the reason for that. I especially want to tell you about steroid eye drops. Any eye drop that has the letter O-N-E in it is incredibly dangerous. The sun is hot out here, it's dusty, the wind is blowing all the time, people have to drive long distances, and oftentimes they use eye drops to soothe their eyes under all these bad conditions. Well, steroid eye drops are absolutely going to make your eyes feel better for a little while, but they have a horrible side effect. If you use steroid eye drops regularly, for even a week, and certainly more than that, it's going to cause you to start developing cataracts in your eyes. That's when the lenses of the eyes become covered with a white film, and it's difficult to see out of them and difficult to see into them. So steroid eye drops can cause the very difficulty that we're trying to avoid by causing cataracts that create blindness and make it even more difficult to see for all those people who really need their vision. So please, even though they make you feel better, don't use steroids.